hand. Hello, Mr. Joseph. Can you hear me?
No response.
Okay, let me check the vitals. Saturation is 97. Blood pressure is 129 or 84 beats per minute. Heart rate is 103. Respiratory is 34. Vitals are fine. Okay, I will assess you. Airway is good. Let me assess his chest.
Trachea central. It's clear.
I will listen to your chest.
Clear. It's clear. Chest is clear.
Chest is clear, heart sounds are clear. Now I would like to assess your calorific.
Normal.
Check your pulse, your temperature, and your blood pressure. Hello, Mr. Joseph, can you hear me? I would like to check. I have to check the pupils.
Equal and reactive.
Equally reactive.
Equal and reactive.
I would like to check the blood glucose. Mr. Joseph's saturation is getting down, so I will put a mask.
It is 1.9. Sugar is 1.9.
Sugar is 1.9. Now I would like to I will insert 2 more cannulas, and I would like to give dextrose. I would like to give 100 ml of 20% dextrose state.
Oh.
Joseph, can you hear me?
Oh. Yes.
How are you feeling now?
I'm really thirsty.
Okay, we will give you fluid. Starting from normal.
Thank you.
How are you feeling now? Mr. Joseph, are you feeling well?
I feel better now.
Okay. I need to examine you from head to toe. I will expose you and I will make sure your privacy. Is that okay?
Thank you.
Okay.
Examination normal. Inspection.
Mr. Joseph Vital showing oxygen saturation 90, heart rate is 129, and blood pressure is 126 or 85. Respiratory is 33. Mr. Joseph, do you have any problem with breathing? Mr. Joseph?
No response.
Okay, let me check his blood sugar.
2.1.
So Joseph, I will give you an extra 20% 100 ml of dextrose.
Thank you.
Mr. Joseph, can you hear me?
2 minutes remaining.
I'm really hungry.
Okay, you will be fine. Just bear with me, okay?
Thank you.
Okay. I will check your blood sugar again after a few minutes, okay?
Thank you.
Make sure that your blood sugar is fine.
Thank you.
Okay, my patient, Mr. Joseph, is 62-year-old. He I found him unresponsive. My assessment showed that his blood sugar level is very low. So I gave him 10%, 100 ml of 20% dextrose. The patient responded. Uh, the patient collapsed again, and I checked the blood sugar again, and I give another 100 ml of 20% dextrose. I
Okay, what is the investigation that you will do for this patient?
As on my observation, the patient might be having sepsis. I will draw blood for the blood culture for inflammatory markers, and I would also take urine sample for the urine cultures.
Okay, what are the things that you can tell me which are suggestive of sepsis in this patient?
Uh, this patient was hospitalized and he was under treatment for urosepsis. He was known. He is.
Can you read the scenario again for everyone to learn?
Mr. Joseph Smith is a 67-year-old gentleman who was admitted to hospital 6 days ago due to catheter-related complicated UTI. His kidney function inflammatory marker are improving, and his observation chart shows that he had been stable during his hospitalization. On arrival, you found that Mr. Joseph Smith is not responding. Please see the patient and manage his acute issue. We are expecting to manage him in
Move on to the next station.
What is the diagnosis? What's the reason? What is the diagnosis?
Could be urosepsis.
Still urosepsis?
Patient is stable.
Patient is stable?
Yes.
Still urosepsis?
Hypoglycemia, sorry. Diagnosis hypoglycemia.
Okay, and who will you refer the patient to?
The patient will be referred to
Hypoglycemia.
endocrinologist.
Okay, yeah. And anyone else?
Diabetic clinic.
Yeah, and that.
Diabetic clinic.
And patient said he's hungry, he can eat.
Yeah, give something to eat and drink.
We'll recheck the blood sugar level. If it's more than 4 milligrams, we'll offer him a good carbohydrate diet. To check if he has skipped any meal.
Yeah, when is your exam again? You're far away.
Now.
Okay. You are a night doctor on duty in the busy acute surgical unit. You are fast briefed by the nursing staff. Mr. Morrison, 67-year-old gentleman, has
Listen, guys.
Mr. Morrison, 67-year-old gentleman, has complex medical background. And now he was admitted with acute cholecystitis for which he underwent emergency open cholecystectomy. You are called to see a patient on the ward as Mr. Morrison is complaining of severe abdominal pain. On arrival, you found that Mr. Morrison is very confused, cold, and clammy. Please see Mr. Morrison and manage his acute issues and discuss the management plan with the patient.
Begin.
Good morning,
Oh.
Mr. Morrison. I'm Dr. Shashwati, one of the doctors.
I don't feel well.
Alright, I'm here to help you. I'm going to check your airway once. Okay, I'm going to check your chest. I'm going to listen to your breathing now. I'm going to attach the monitor to his hand. Okay, I'm going to check your circulation, Mr. Morrison. Just bear with me.
Oh. 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 Oh.
2 seconds.
Oh.
Huh?
That is 2 seconds.
Okay, Mr. Morrison, I'm going to give you fluids now. How are you feeling, Mr. Morrison?
Thank you.
I still have the pain, doctor.
Okay, can you point to where the pain is?
It's in my tummy.
Okay. Can you tell me when it started?
I've had the pain for a couple of hours now.
Alright. Can you tell me what it feels like?
It's really sharp pain.
Really sharp pain. Can you tell me, can you rate the pain for me from 1 to 10? 1 being the lowest and 10 being the highest pain you've ever felt, the most intense?
Oh. I'm so sick.
Okay, I'm going to give you some oxygen, Mr. Morrison. Wow.
Thank you.
Okay, Mr. Morrison, I'm going to check your eyes. Going to shine light in your eyes.
Equal
Please
and
bear with
reactive.
me. How are you feeling, Mr. Morrison?
Still the pain.
Um, okay,
Oh.
I'm going to
Oh.
put 2
Oh. Oh.
large IV bore needles in your arm, and I'm going to give you some IM morphine for your pain.
Thank you.
How much morphine? Okay. The morphine will take some time to kick in. Please bear with me.
Thank you.
Um, can you point to me again where your pain is, Mr. Morrison?
Oh. 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 Oh.
Okay, I'm going to expose your legs, Mr. Morrison, to see, to check for any injury, any bleeding, any redness. Please bear with me. I have a chaperone to ensure your privacy.
Thank you.
I'm going to check your tummy now, Mr. Morrison. Please tell me if you feel any pain.
Oh. Oh. Oh.
Yes, there is pain.
Oh.
I'm so sorry, Mr. Morrison. There's still pain. I'd like to repeat IM morphine. Um,
2 minutes remaining.
What happened, doctor?
Should I send him to the theatre? I don't know. Send him back to the theatre.
Why have the pain this in my tummy?
Because there is a complication of surgery. I don't know.
Okay. No, you're doing the right thing. Carry on.
Okay, I'd like to send you back to the theatre for re-exploration to see if I don't know. I think I'm missing something.
Blood pressure is fine. Pulse is fine. Concentration is fine.
BP came low. Did you give the IV fluid?
No, I did. I gave him saline.
Blood transfusion.
No transfusion.
It's fine. No, that time it was
He's
90.
stable.
It was 90 something. Before.
His pulse,
The pulse is rise because of the pain.
because pain. Yeah.
I don't know, so you have maybe because of the pain. He's
So what?
tachycardic.
I should send him back for re-exploration. I don't know.
Why to send all his vitals are improving? There should be a reason if there is a drop in the
So
patient is hypotensive.
So should I give him more morphine? Okay, now he's fine.
Okay.
Unless he's dying. No, he's not.
Okay. No, you were doing the right thing. Okay.
And then I don't know.
Then you got stuck. Then you got lost.
Yeah.
Okay. What you need to do is this is a post-op
Was it
patient.
more systematic than last time?
Yes, yes, of course. There was major difference in him and you as well. You will get the other chance. So this is a post-op patient. The pain can be because of the tight sutures, can be because of the surgery, can be because of the contamination, can be because of the injury. Okay, so there are certain reasons why the patient could have pain. Just simply and discuss management with the patient.
That's
So yeah, okay. So you did nearly all the things right. Okay. Then you would have spoken to the patient. Don't worry. Sympathy, empathy. Where is the sympathy?
Okay.
Where is the
No,
empathy?
I thought I screwed up somewhere. Okay, never mind.
So you were doing everything right. Just give some reassurance, provide sympathy, empathy. Do not worry. Okay, I will come and review you again. At the moment, I feel that because you had the operation, because of that you have this pain. Okay, if your symptoms come back on, I'll be here. Don't worry. Just let the nurses know. So this is what you are going to. Okay. However, if your pain continues coming, getting worse, we may need to do a scan of your tummy just to find out if there's any complication from the operation. If I just had 2 minutes discussion in the gossips with the patient. Okay. But he thought that you were doing something wrong.
Yeah, I think it's my confidence.
So they
So what about
don't
like
need to be any diagnosis.
Yeah.
so don't you need to ask like for how long the previous dose of medication was given?
Was anything given after the
Was
surgery?
anything given after the surgery, or I need to check the notes?
Well, you can say that. You can say that.
And
But that's not the failing point. The main
no,
thing
that is
is
not the
main.
failing point.
Yeah.
But that is something you can get more marks.
Yes, of
To
course.
rule out allergies.
Yeah,
How
rule out
much
the allergies. Sir.
morphine you can give.
It's 5 to 10 milligrams every 2 to 4 hours. Okay.
5 and
Sir,
I am up to
IMIV.
IMIV.
The patient is unresponsive. Can I give pain stimulus to the patient or
Yeah.
shake the patient?
Yes. If the patient is not responding, that's a P, isn't it? If you want to give the pain. AVP to scale. Okay, response to the pain.
But 5 to 10 milligram up to 2 hours. I
Yeah.
am IV, but up to how much milligram we can give?
Maximum.
Maximum. What is that?
Or 240. 240. Okay. In severe cases, if there is terrible pain, you can reduce it. The duration. Okay. The maximum recommended dose for the healthy subject is 10 to 10 to 20 milligrams every 2 hours. Okay, which means 10 milligram every 1 hour. That is a maximum dose. However, that puts the patient at risk of developing the respiratory complications and the other stuff. Okay. You can think of giving anything else, ibuprofen, paracetamol, and maybe amitriptyline, tramadol.
As we are giving that much painkiller, we are not giving any anti-emetic kind of.
Well, you can give it. ठीक है
Sir, आपने कहा 10 to 20 gram morphine.
5
to 10 milligram.
So normally the recommended is 5 to 10 milligram. This is, but in the worst case situation,
That
we
is the
can give.
maximum.
Yeah, that's a maximum. That's it should not go beyond that. Hello.
Can I do more?
Hmm? The case was a post-op pain. Yeah, we'll do couple of yeah, post-op pain.
So did somebody cancel the sheet for you, or you just? That was
I was looking for. You want to rush or something?
Yes, there is someone. You know, you put the oxygen upside down.
It happens.
What else we have discussed before?
Like that?
Yeah, it was upside down.
Hypoglycemia he did. And
I was actually on the first time I was blind. I was just
No, that's what second time you will improve, I think.
Yeah, so
You were there when I was.
No.
Who
No,
was
I'm
there?
just saying myself. Next
Who
time
was
I'm
there?
looking at it.
You were there.
Yeah. But I didn't watch your
No.
second one.
You didn't watch the second.
No, I came in between.
it was very better.
It was good.
Yeah,
Like,
you improved in second.
you, I think the better thing is to observe 1 or 2 stations and then do it. Like,
Yeah.
go for it.
Yeah.
Whatever.
Okay, for AFib, the thing is like
I
there
think
will
you
be
are more
afibrillation
calm.
on the
Yeah.
ECG.
Yeah.
Yeah.
Just always
And then
Let
the
it
other thing
happen.
is
Let
you will check the pulses, like you said that pulses.
Yes.
Can you feel me? Senses, motor, if these are present, I will refer
So
you
in
to
that
the
case, you're not
Now
doing
he has
it.
developed hypoglycemia.
If
So your diagnosis
pain and sensation are active.
Or,
What's the
Even
first
pain,
What's the
yeah,
first
even
case? Pneumonia?
that was success and confusion.
Confusion. So, did he answer you?
So we will
When
give
you
him
asked.
on 5,000.
No, he was
units
answering
of
it, but he was
heparin
just saying that I am unwell and nothing more.
instantly,
Yeah,
and
Just
then
saying
give
that I'm
5,000
unwell.
units
Unwell.
IV stat,
And
Unfraction.
Not
confused
saying.
patients what should
1,000
be
units
Okay.
IV and fraction over the next
16 hours. Doppler and CT angiogram.
Doppler for everyone, CT angio only for patients without pulsing.
Not without pulse, with pulse.
Who has a sensations?
You have some
Who has a sensations in the power? Okay.
power and
If the sensations of power is gone, then you don't do it. Then you're going to waste time.
and sensation. Like, and what else? What else? Anything? Okay.
No, there's more.
1 2000.
Then, if supposing the patient has started with acute leukemia, okay, and the patient starts coughing. So when the patient has acute leukemia, then it is very likely to develop.
We'll do one more.
Can I do? One patient died, so can I do?
No, I think the scenarios are finished as well.
Yeah, we have not done PP.
PPH,
You're done too?
One.
It's okay, you will do it again.
that's more clotting because the first clot triggers cytokine response. So they can develop a PLAB. Here I have a patient. Okay, this is another scenario. I have a patient who is vomiting, giving him Then before that, there was upper GI bleeding after patient took diclofenac. So we did figure maybe I don't know.
So doctor, like in confused patients,
Hmm.
shall we assume that because the patient won't be able to answer properly, can we just say from the notes, I can see that you have been infected with
Yes,
something
yes,
here,
yes.
and I assume that the patient is having sepsis with the
Yeah, based on your
based on,
findings.
yeah.
Yeah, based on your findings.
Yeah.
Even if the patient is unconscious, we know.
Mm.
Okay. So, whose exam is early? No, you wait.
Minus 19th.
19th. Okay.
So you are FY2 in the
Begin.
Department of Gynecology and Obstetrics.
Yeah.
It's not beginning, yeah. Where you are called to see 37-year-old Mrs. Mark in the recovery. Mrs. Mark is multigravida and has delivered her fourth child about an hour ago. She's bleeding profusely per vaginally. Nurse has told you that she already changed 2 bed sheets and given some IV fluids. So, however, the bleeding is not improved and the patient is feeling unwell now. Please see Mrs. Mark and manage her appropriately. Should I begin? Should I begin, doctor?
Great. Let me see.
Dr. Naga
Begin.
Ramamurthy, GMC 7762-830. Hello. Hello, Mrs. Mark. I'm Naga, one of the junior doctors here. I've come to take care of you.
I'm so sick.
Okay. All right, Mark. Since when are you feeling sick?
Since 2 hours, doctor.
Okay, all right. So you're talking, so I assume that your airway is clear. So I'm going to give you some injection. Yeah, and I'll be giving you an injection cyclism through IM.
Thank you.
Thank you. And I'm going to check your breathing now. Is it okay if I expose your chest, Mrs. Mark?
Yes.
Okay, all right.
Assume exposed.
Yeah. I can see that your chest walls are moving equally and there is no abnormal movements. So I'm going to just tap on your shoulder, chest, Mark. Mrs. Mark, is that okay?
Yes.
Okay, I'm going to listen to your chest, okay? Okay, your chest looks clear. I'm going to order some X-ray and ABG for you, okay? How are you feeling now, Mrs. Mark?
Same.
Sorry?
Same.
Same.
I'm feeling very dizzy.
Feeling dizzy. Can you let me know what do you mean by feeling dizzy? Is the room around you spinning?
Yes.
Okay, since how long you're feeling dizzy?
After the operation.
Okay, I understand from your notes that you have you have just delivered. Is that right?
Yes, doctor.
Okay. So don't worry, Miss Mark. I'll just continue with my examination, and I'm going to give you some relief. Okay, some medications. All right.
Thank you.
Okay. So just looking for the pulse. Pulse. I'm going to just squeeze your finger. Okay. I'm going to listen to your heart. Okay, Mrs. Mark. Everything seems okay. I'm going to put 2 IV large dose cannula. Okay. I'm going to give you some 500 ml of saline.
Thank
Okay,
you.
through one of your veins over 15 minutes. And I'm also going to take your blood for routine investigations and
Thank you.
send your blood for grouping and cross matching. Okay. All right. And also, I would like to record your ECG. Okay. So, Mrs. Smart, is it okay if I check your um, check your pupils here? I'm going to show some light on your eyes. I'm going to check your blood sugar. Is this light ray coming?
6.8.
Okay. Okay, Mrs. Smart, your blood sugar is good. So, since you said you have delivered a couple of hours ago, am I right? I'm going to expose
Yes.
you from head to toe. Is that okay? I have
Yes.
to, yeah, undress you and have a chaperone with me all the time. Okay.
Thank you.
Okay. So, Miss Mark, I can see that. There's
Yeah, there
bleeding.
is blood. Yeah.
Yes, I can see that you're bleeding a lot. Yeah, since you have just delivered. Okay. So what I'm going to do is, I've ordered the blood. Okay. Till the blood receives, I'm going to give you some massage in the uterus. Do you feel any pain in the abdomen?
Yes, a little bit.
Is it okay if I?
2 minutes remaining.
Yeah.
Yes.
You feeling better? Do you still have the pain? So I'm
No.
going to give an injection, oxytocin, 10 milligram IV through your
That
veins.
helped.
Thank you very much. How are you feeling, Mrs. Mark?
I feel better now.
Okay. So 2 minutes. I have to talk to your patient.
You need to read this, Harry.
Okay. Okay, Mrs. Mark. So I've given you many things. So can you tell me, is this your first delivery?
No, this is a fourth one.
Okay. And have you experienced any kind of bleeding like this before?
No.
Okay. And do you know how did you deliver through vagina or did you?
It was a vaginal delivery.
Okay. Was there any tear or any kind of instruments used?
I don't know, doctor.
Okay. Thank you, Mrs. Mark. And from my assessment, I think you have this bleeding because of the delivery, which we call as postpartum hemorrhage. Okay. So I have given you IV fluids and massaged your uterus and given some oxytocin injection to improve your contraction of the uterus. Okay, for
Thank
your
you.
womb. So after this, if you still feel painful, okay, and this bleeding is not controlled, okay, I'm going to call my seniors and we'll be giving you some injection ergometrin through your veins, okay?
Thank you.
And even if it's not improving, we'll call the anesthetist and we'll do some procedures to control the bleeding, okay?
Thank you.
By the time the blood arrives, I think you can get
Move on to the next station.
and you'll feel better. Thank Thank you very much, Mrs. Mark.
Thank you.
I hope you have a good recovery.
Okay. So, it was much better. Okay. What are the guidelines?
For treatment.
Yeah, come and see that. This is the plan.
Okay.
You can come and see. You all can come and see. I wish. So, nil by mouth, IVI oxytocin injection, abdominal massage, blood transfusion,
So
theatre.
IVI is IV.
Intravenous infusion.
अच्छा IV fluid.
Long pole heart.
Oxytocin injection, abdominal massage, blood transfusion, theatre if no improvement.
Okay.
So, as this patient has already, she has delivered, so her blood grouping and cross matching has not been done. So, we can start the or
No, she has already delivered, and group and save must have been done when the patient is admitted, especially when they are there for the delivery. So this is the protocol from A and B assess airway and breathing. C evaluation, position the patient flat. This is the nice guide one. Okay.
Patient should be lying flat.
Yeah, because otherwise.
There would be more gravity effect and more flow.
No, the patient will cerebral hypoxia. Okay.
Yeah, hypoxia. Yeah.
The patient was feeling dizzy.
Mm.
Okay. It was the reason because the patient was sitting upright.
Make patient flat.
Infuse up to 1.3 liters of want clear fluid initially. 2 liter. 3.5 liter. Okay, this is maximum that you can give the patient.
Initially 2 liters and up to 3.
Yeah. It does not say anything. It says isotonic saline, which means a normal saline. Okay. Isotonic crystalloids. Further fluid resuscitation can continue with additional isotonic crystalloid or colloids. Hydroxyethyl starch should not be used. So this is exactly from the
NHS guideline.
no nice guidelines.
Nice guideline.
Is it in the is it in your note?
It will be. I will add them tonight. Okay. So this is a monitoring how you need to monitor. This is again from the nice guidelines. Okay.
I should have about the coagulation.
So 2 cannulas, 14 gauge, police catheter for the monitoring. Okay. Okay. This is something else.
But I cannot understand about the patient. If PPH patient is in shock, obviously, she must be in shock. So I have to start with 1 liter of fluid in 15 minutes. And then I have to reassess after 15 minutes until a maximum of 2 liter, 3.5 liter is given. In how much time span?
2 hours.
I think it depends on how worse the patient is. There is no time restriction.
But the maximum I can give is 3.5 liters.
Yeah.
And we'll start with 1 liter
In the
within
meter.
15 minutes.
So here it says IV fluids is given already.
But your note says that
So
500 ml.
Huh?
500 ml. No, 1 liter, sorry.
She's shock.
Yes.
In shock, more
Shock,
fluid.
it was not shock. It was 110 or something, right?
No, it was. You can see it is still
90
showing.
by
After
70.
that it dropped.
I don't know. Just asking randomly. I didn't
So
know.
it's already they have given some.
See,
IV
there
fluids.
are different ways of treating the same problem. Okay, you guys are sticking to unnecessary things.
Yeah.
Fluid is fluid. You need to give 1 liter in 15 minutes. Okay, another liter in the next 15 minutes. It is not a crime if you give in 10 minutes. Okay, it is not a crime if you give in 20 minutes. So you need to monitor according to the situation. There is a variation. Okay, 3.5 liter. If there is no blood, you continue giving more.
Yeah.
Okay, it's a 3.5 liter warm saline to uplift the blood pressure according to the NICE guidelines. But these are according to the standard situations when you have all the facilities.
Yeah.
Okay, in countries like in Pakistan or in countries like in the UK, if the things are busy, you are not able to get hold of any blood bank, there is no blood. Are you going to stop resuscitation?
No.
Okay, so these are the common sense things. We need to follow the common sense. These are not the Bible. Okay, these are help us to guide what are the actions we need to do. Okay, there are certain limitations and there are certain flexibilities as well at the same time.
Okay.
Okay.
Thank you.
Thank you, sir.
Was this okay? Was it
Yeah,
okay?
yeah, it was okay.
So what
Uh,
we gave cyclizine?
At first, she said she's vomit. I mean, she feels like nausea.
What is the dose of